only you can fix your knee pain. It doesn't matter how old you are, 80 years old, or like me, in my 32, I have a lot of knee problems. It doesn't matter. This technique is safe and effective. If you have knee pain in front of your knee, around your kneecap, under kneecap, above kneecap, on the sides, inside your joint because you have osteoarthritis, this technique, when you will do this, decrease your pain or even can remove if you will do with persistence and regularly. So this is your kneecap. It's a bone which is sliding when you flex and extend your leg. This is your tendon. It's the end of muscles. I ask you to do very simple thing. Remove your carpet, your socks, put your lower leg in 30 degrees and you make your leg stable. And in 4 centimeters above your kneecap, just press with your fist and press for 30-60 seconds. Stay here and press hard, strong. Press here, and in this moment you will relax your tendons and then muscles, and it will decrease load, pressure inside the joint. Why do you have pain in your knee? Let's change a point. 3 points in 4 centimeters above your knee. Let's do here. When you relax your tendons and muscles, you relax your knee, because some tired, overused tissues inside your joint already create some pain and sensations when you move or even when you rest, unfortunately. But why you have this pain? I think you don't want to have this pain, especially when you do not something crazy. You just walk downstairs, upstairs, you walk, you squats, sit down, even if you rest. It's normal things. Even running don't must create pain. And change position and press in another point for 30-60 seconds. Muscles are shorted and they press your joint. And your joint already have too much pressure inside. Your parts in your joint are pressed, have load, pressure. Your muscles are shorted, it contracts a joint and it creates pain and sensation. I show you technique which can relax your muscles and make some space between your bones, between your meniscus, kneecap. When it will be relaxed, your knee will feel better and no pain. Let's continue. Tendons are connected to muscles. And let's do another point. And just press. This is muscle. Your aim to find painful points in your muscles and press. First 5-10 seconds you feel muscle tension, some muscle pain. It's your aim, it's a goal to press, and you will see that at 30 seconds, if muscles was shorted, it become relaxed. The pain becomes smaller, muscle pain. It's muscle pain when you press by your fist, it's safe for your joint. Then change position. I will not stay every 30 seconds in every position because it will be a very long video. I just show you the map and how to do that. So do different points here, different points here, here, all your thigh muscles, everywhere. Muscles are contracted and pull your joint, and it press your structures to the bone, to each other, and create some sensations and pain. Relax your muscles by pressing, and you will feel relief. Unfortunately, I visited 16 doctors, orthopedic doctors, surgeons, and no one told me this. They advised to do surgery. I took their painkillers, prescriptions, I did hyaluronic injections, PRP injections. It didn't help me. It did worse until I found this technique and others. I will show in the next videos. This is advanced approach because I saw just a little part. Usually in internet, a lot of internet guru specialists don't show this free natural relief. People use pills, surgeries, braces, insoles, injections, and suffer, especially people with heart diagnoses, 4th grades of osteoarthritis, chondromalacia patella, with cartilage problems, etc. For example, I have chondromalacia patella 3rd grade. Its patella was in not correct position. I already fixed that. I had meniscus tear, ACL tear, and early osteoarthritis, and Baker's cyst. And the first my year, when I followed doctor advices, followed online internet advices, I used cream, pills, everything become worse until this. This technique and similar opened my eyes to all this healthcare picture. I ask you, if you have knee pain, try this, do this, and write your comment how you feel yourself after this muscle relaxation. Stay for 30-60 seconds at every point. Find painful points. Your aim is press and relax painful points. It means in that point muscle is contracted, shorted, and you press and muscle become relaxed, and it returns to natural length, and then it press your knee less, and you feel less pain, or can remove at all. It depends on condition and stuff like that. If you have pain chronic, I advise you to do this every day, in the day when you have pain. If you will do regularly, you will achieve a good result. You can do this with another leg also, because even it doesn't have pain now, it can have pain in future, because the damage inside knee is so low that it don't create sensation pain, but it doesn't mean that your muscles are not shorted. So help your body to relax muscles and keep your knee healthy and safe. Honestly, our body must have natural technique to relax our muscles, but modern life creates a lot of stress. It is chronic stress, 24 hours, for months, for years, and our body don't work correctly in modern life. And we have muscle imbalance. We use some muscles more and some muscles are weak. That's why a lot of people have kneecap in not good track, not on good track. We have weak foot, we have weak glute. That's why bones in one point have pressure and contact. A lot of people have medial meniscus tear because of muscle imbalance. I know in internet, you and we see a lot of advices how to fix pain with exercises. It can be. Exercises are good for correct muscle imbalance, but if you have pain and you do exercises, it contracts your muscles more, press your joint more, and you feel pain more. In future, when you fix muscle imbalance, it will create less pain. But it is not good option to do only exercises and make muscle shorter more and have more pain and use your knee tissues more and do harm your knee more and more. I relax you, relieve pain, and then you can work with muscle imbalance correction. When you work with all these points, go press all points closer to your pelvic, and especially close to your pelvic and hip. Press tendons, find painful points and press. I hope this will help you. You will not have pain. Please write your experience with this technique, what you feel. I will be very happy to help you, and I will share more useful and real tips, advices in next videos. So see you later. Bye.